It is my pleasure to welcome Dr. Zahar, an Associate Professor of Medicine and the Director of Interventional Cardiology at Oregon Health and Science University. Dr. Zahar, congratulations again on your late-breaking trial at TCT, the one-year outcome of the CLASP 2D trial. Can you give us background about the hypothesis and the methodology of the CLASP 2D trial?
Yeah, Abdullah, thank you so much for having me today. It's a pleasure and honor to be invited by Jack Intervention to one, accept this paper, and two, to have this conversation about it. So the CLASP 2D is the first randomized trial that took two contemporary mitral TEER devices, the MitraClip and the Pascal system, and in anatomy that is deemed by the screening committee, as well as the echo lab that are suitable for randomization, were randomized 2-to-1 Pascal to MitraClip. And the primary endpoint was safety and efficacy, safety at 30 days and efficacy with MR less or equal +2 at 6 months. The secondary endpoint, which is what we're presenting in this paper, along with the primary endpoint, is also including MR less than 2 at 1 year and MR less than equal of 1 at 1 year.
Okay. Exciting. Yes. Huge congratulations. Is an important question and kind of an important topic to cover. Can you share with us the results of the CLASP 2D, the secondary outcomes?
Yeah, absolutely. So, the exciting the exciting news is, both the Pascal system and the MitraClip system has demonstrated, safety at 30 days with a low, very low, less than 5% almost MAE rate at 30 days. The efficacy of MR reduction less than or equal to 2 was achieved in almost 95% of the patient population in both groups. Even if we scrutinize it more and we say we want to look at those who have MR, residual MR, less or equal 1, it was achieved in over 70% in both groups. It was numerically was a little higher in the Pascal group. However, it did not achieve statistical significance.
Wow, truly impressive, and it kind of adds more tools to our box in terms of what we can do for these patients, and having multiple devices and multiple options, and it's impressive. And my understanding that even the mortality was lower than the previously reported mortality in these high risk patients. And correct me if I'm wrong.
Absolutely. This is another step forward in demonstrating the safety and efficacy of mitral TEER procedures for treating patients with degenerative mitral regurgitation who are at increased surgical risk. It enhance our ability to use more tools for different anatomy, and also, trying to figure out some of the device features that might make procedures easier and outcomes even sometimes more favorable for those patients. So it is very exciting that it's safe, effective, and the results are durable up to 1 year, as we demonstrated in this Jack Intervention paper.
Perfect. And lastly, what's the planned follow-up for the trial and future directions from your end in this specific topic?
So this is just the beginning. The trial is following the patients to 5 years, so we're really going to have long-term outcome in contemporary data about the durability of MTEER. And as there are more options that are available for us right now to treat patients. And as we understand, the mitral pathology better and the devices better, I think we're going to continue to improve our outcome as we move along.
Thank you so much. Thank you so much, Dr. Zahar, for this truly impressive idea and topic. And congratulations again on your trial.
Thank you so much, Abdullah, and thank you for Jack Intervention for accepting this paper and having me spend the time with you today.
Thank you, Dr.